quote unquote, in a hairline advancement, how much control do you have in shaping the hairline? A modest amount. It's probably less than I would like, but probably more than I'm surprised that we get as much as we do. So because of the way the pattern of hairline advancement surgery or the incision is designed, what's happening is the central wad of hair is coming down and then the temple hair is coming up. And so the corners that most people tend to complain about, the visible peaking or a temporal recession, tends to improve, but it doesn't really go away. So I usually tell people that I'm going to significantly decrease the amount of real estate in those temporal recession areas, but that you're likely still to have some. And the treatment for that is that hair transplants can be used, and I think most effectively used, a minimum of about 9 months after you're finished monkeying around with the hairline. Okay, everything is healed, the circulation is back to normal to your scalp, and you have the best opportunity to get essentially the best graft survival of your hair, and we would be decreasing the amount of real estate that you would need to cover. So more grafts, or at least the same amount of grafts, are going to cover the same amount of area more densely. And so I think that that's the right way to do it. I would say that there is a technique where people have been placing the incision further back in the scalp and then using the hair that comes out when you snug all that up to transplant the hairline. But I see a logical fallacy from my point of view as a physician, and doing something that effectively raises the hairline up and then charging the patient to then transplant the hair to lower it again. And not only that, okay, you can achieve some rounding of the hairline by doing that, but you're still effectively leaving the patient with a higher hairline. The other issue with that is that the hair density in cisgender females tends to be a little bit more sparse in the temples. And so hair transplants work very effectively in the temples to recreate a very natural looking appearance of a feminine hairline, whereas they tend to be not quite dense enough to really recreate the central forehead portion of a hairline. And so it often tends to have a bit of a weeds before the forest look to it. So we can improve the shape of the hairline, but I don't think we completely resolve it with a traditional scalp advancement. It does, of course, depend on the shape of the hairline of the patient coming in. So some people come in, don't have nearly as much temporal recession, and it's simply one and done, and they don't even need to think about it. But so again, that's where these kind of, there's no replacement for coming into the office if you're serious about having some surgery. But generally speaking, yeah, we can improve the shape, but we won't completely resolve it probably with a single surgery, depending on how picky you are about the hairline shape.
I would just say that I had very advanced hair loss, like it was about here. And so Dr. O moved my hairline forward about this much, which made all the difference in my case. So because your forehead is such a big part of your face, that was the thing that made all the difference for me.